How has Temple Health changed its strategies over the course of this partnership? Meaning, how are the AMN Healthcare Solutions, mobilizing that change? If you can just give us a little bit insight on that.
Yeah, sure. So we also went into this partnership in the middle of COVID, right? So
Yeah.
everybody is scrambling to get staff, and agency levels were like the rates were at the highest, and the ability to get staff was just becoming increasingly difficult. Here we are in a large city. We were caring for the most amount of COVID patients at the time. We were all confused and didn't know how to handle it. But when we went into this partnership, we were like, help us get staff, however, by whatever means. And, the VMS team took that and said, here we are in the market. If you raise your rates here, if you need specialty here, do that. Let's see what that gets us. And at that point, we were looking at people, resources. We needed the people here to help us take care of the patients. So that was working for us at the time. But over time, and as our resources became more available and our staff, we were starting to get people permanent replacements. The VMS team also looked at that as well and said, okay, time to start dropping these rates. Now let's look at how we can get more permanent people in here. So we went from, and this is just an example of how we've switched how we were using your services. We went from highest rates that we needed to get people into, dropping the rates and continuing to look at that. And at the same time, recruiting for permanent positions. And now we're kind of going backwards because we also utilized the open shift. We started creating incentive shifts, but realized at some point that our incentive shifts were higher than our agency rates. So now we're rebalancing. Another example that was suggested was when we had agency, they were placed in separate units. So again, that controlling, like we need to manage our own people. But what we found was there were some units that had more agency utilization than the ones that had a higher vacancy rate. So we needed to move everybody. So the suggestion from our partners at AMN was that move all of your agency into the float pool, right? So they were deployable to who needed them. That was allowing us to become more efficient with the agency workers that we had. Instead of paying for more here and here, they saw an opportunity that we were able to put them all in one area and deploy them as needed. So we did that, and that has been how we've handled our agency for the past year and a half now, and that's worked out very, very well.
Thank you for joining us today on Elevate Care. If you found this episode valuable, please consider sharing it with a colleague and subscribing to our show on your favorite podcast platform. You can learn more about this episode and our show on our website at amnhealthcare.com, and follow us on social media to stay updated on new episodes and the ever-changing world of healthcare.